Prostate enlargement is something that is going to happen for every man because it is governed by A, the testosterone in his body, and B, the aging process. So there's nothing that can stop a man developing an enlarged prostate, except it's a very small community in the country called the Dominican Republic, where they have an enzyme deficiency in their prostate, and therefore the prostate doesn't grow. So should we call them lucky? Or should we say that the urologists are not required to treat prostate enlargement in patients in that community? I think the question is open for discussion and debate. Well, as I said in my previous answer, or my explanation, that a prostate enlarges with age. So unless you have a solution to stop aging, you can't stop the prostate from enlarging. So it goes hand in hand with aging. That's a very astute, straightforward question, but the answer to that is going to be long and winding because everybody is different in the way they present with an enlarged prostate. What we got to look at is 50% of men above the age of 50 are going to require some kind of intervention for their prostate enlargement because that is causing them symptoms. So we do not treat an enlarged prostate. We treat an enlarged prostate causing symptoms. And therefore, the focus is on managing the patient's symptoms and then tailor-making the treatment to try and address their presenting symptoms rather than using the word treating the enlarged prostate. So it starts with as simple as conservative or lifestyle management, including fluid management, whether to drink caffeine, alcohol, whether to reduce it, when to have supper time, how to address bowels with constipation perhaps in the background, and so on. Second line, if this doesn't help, which of course helps a large proportion of patients, is the medications. And over the last 30 years, we have developed with research in urology so many medications that they work wonders for a large population of men presenting with enlarged prostate. And therefore, the incidence or the requirement for surgery has gone down significantly over the years. But of course, if patients do not respond to conservative lifestyle management or medications, then we move on to surgical treatment options, of which surgery has evolved over the last 70 to 100 years, 70 to 80 years, quite significantly from what was an open surgery for prostate removal to endoscopic or camera, through the camera for prostate removal, and now to minimally invasive treatment again to try and address the enlarged prostate. Enlarged prostate can be treated without surgery, but whether you call that as non-surgical treatment or minimally invasive treatment or minimally invasive radiological treatment is something that you can choose from. But yes, it can be treated without surgery. And the latest addition to the whole armamentarium of treatment for benign prostate enlargement is prostate artery embolization, which is actually carried out by a radiologist or an X-ray doctor in a radiology suite, not in operating theaters. And they go through the artery in the groin to the artery supply in the prostate in the pelvis and just try and block off the prostatic artery. So it's basically cutting off supplies to the frontline army, and that means the army can't function. So similarly, the prostate can't enlarge. So that's the only non-surgical by definition. All other procedures that have evolved, although they are called minimally invasive, they're still surgical treatment options. So yes, if non-surgical medical and lifestyle measures don't help, then the only option is surgery. But that is really individually tailor-made, because if the patient's symptoms do not bother him, then he need not or would not progress to any surgical intervention. Ultimately, it's down to symptom control. Well, I wish I knew the answer to this question. I don't think anybody does. But as I said to you at the beginning, it's the testosterone that a man has. So if a man's testosterone is removed from his body, either accidentally or deliberately when he's a young child for any reason, then he will never develop his prostate enlargement. But that's not going to happen in real life. Otherwise, with age, everyone's prostate is going to enlarge. So we can't really stop it. because it's a part of a male hormone sort of effect on the genital organs. Prostate is one of them. I think this is a very good question, and most men ask the same question in our clinic setting as well. But again, as I said, there is no evidence to say that a food item or a particular food makes the prostate grow or enlarge rapidly than others, because it is not under the control of the individual as to whether he can tailor make his diet to suit his prostate, unfortunately, because the main control is hormones, which is testosterone, and the age. Yes, if you're talking about prostate cancer, which develops within an enlarging prostate as a part of the benign prostate enlargement, but a small focus of prostate cancer, then there is some soft evidence in the literature to say that eating certain things over a long period of time, not a short period of time, may help reduce the risk. But again, this is very soft evidence, so we never categorically say to an individual that they should follow this, but things that can help reduce the overall risk of developing prostate cancer or maybe slowing down its growth would be cherry tomatoes, cooked tomatoes, pomegranate, and pumpkin seeds. What makes the prostate irritate or perhaps makes it more prone for the development of sinister problems, and again, a loose, very soft evidence, is burnt meat, i.e. barbecued meat, etc. But again, you're talking about eating large amounts over many, many years. So having a barbecue every now and again in the summer, I don't think is going to upset anybody's prostate.